Respiratory problems in cats are common. You can hear she's having trouble breathing through a little nose, and her eyes are very red and inflamed. Look at those membranes. It's the infection she has, which can be viral or bacterial, can cause all these symptoms. Some cats, most cats, contract herpes virus or mycoplasma or chlamydophila, and they just, their immunity gets rid of them. This test, but I'm going to take a slide, I'm going to press it on the membranes of the eye to see if I can see what kind of bug is causing the infection. We're looking for mycoplasma or chlamydophila. The other causes of infection in eyes, herpes virus and calicivirus, don't really show up. But just for fun, let's possibly see if it's mycoplasma or chlamydophila. If it's either of those bugs, then we'll use doxycycline and tetracycline eye ointment to see if we can make this little Sphinx feel better. You're kind of a little monkey, aren't you? Huh? You're breathing on my neck. Could you? Well, that's nice and everything, but now I have to do my work. So the smear of that kitten shows a lot of these are not very easily seen, but there are a lot of white blood cells, and they're usually associated with pus, and so that also could mean that this little kitten is infected with a bacterial agent instead of the viral. So we'll see how the antibiotics work. So if we look at this chart, any kitten or cat with red eyelid membranes can have herpes, which is FH1, which is a virus, or it can have chlamydophila, which is chlamydophila felis. If the membranes are really swollen, it's more towards chlamydophilus. So that kind of sways us to think that this kitten has chlamydophila. And what's the nice thing is chlamydophila is sensitive to antibiotics, so we hope that antibiotics will really help. The snore, the respiratory sounds, herpes can have respiratory sounds where chlamydophila may not. So this cat may have, this poor little naked Sphinx may have two things. It may have a viral infection and a bacterial, causing both those symptoms, and we hope it doesn't. So when you put ointment in an animal's eyes, and we're going to put ointment in this little kitty's eyes, you try to be as gentle as you can, and you lift the eyelid. Sometimes it's better when they can't see, and you don't need too much. You just put barely any in there, and you can do it 3 times a day. And I'm going to do the other eye. Oh, she's really good. There you go. Hopefully I get that swelling out of there. So this is tetracycline. There's a couple of different forms of eye medicines that they're good for bacterial infections, terramycin and oxytetracycline, and also erythromycin. So we're going to try doxycycline now instead of what is erythromycin that she was on before, and doxycycline would be 0.3 mLs twice daily. So we have these handy dandy little dispensers where you put it in there and draw out 0.3. So we're going to go draw that out. There's 0.3, 0.1, 0.2, 0.3. Not very much for this little kitty. And then we're going to put the lid back on because we want to be safe and not spill it. And we're going to show how easy it is to give a kitty liquids. Just put it in the corner of their mouth, like that, and then just and then she swallow it. Oh, isn't that a nice kitty? Yeah, she says, thank you, doctor. So anyway, I hope that makes her better. We're going to use the antibiotic doxycycline twice a day and terramycin ointment 3 times a day. And we hope all your sinus problems get better. Hairless one. It's not uncommon for cats to have a little runny discharge from the inside of their eye, and the watery discharge can also be a sign of a real mild infection
or even something like irritation from dust or pollens or molds, like in hay fever. But if a cat's holding that eye closed, and there's any grayish part to the clear part of the eye, it's always best to get a checkup, because it could be due to a scratch or puncture or foreign body.
If it happens off and on, it can even be due to pollens and molds. It can be allergies. So we're going to treat Baxter's eyes with a little bit of steroid ointment and see if they get better. Does that sound good, Baxter? And we don't use steroid ointment when there's any ulcers in the eye, but we use it when there is inflammation like this. So we just put a little tiny bit. When you use ointment, you don't want to put very much. See that? And then you just rub the eye down. Yeah, he likes his ointment. See how much I've got on the end there? That's not very much. Don't use a whole bunch. You just use that much, and you can use it 2 or 3 times a day. Usually I rub it on the upper lid like that, and then I push it down with my finger and massage it around. He likes it. And then I'm going to wipe his eyes out with a little. Then you can use a little warm water and a little piece of gauze, and you can wash the eyes away. Wash the eyes away. No, you don't wash the eyes away. You wash the gunk away from the eyes. So you can do that. And then that way I get to see tomorrow if the eyes are less gunky. But you can see there's always a little drainage here because it's discolored right there. Isn't he a good kitty?
Well, we talked a little bit about herpes and infection in the eyes, but I wanted you to see a picture of what it might look like in your cat. Just imagine your cat has that swollen red membranes that the kitten had and some runny eyes, and even maybe sneezing a little bit. We put a greenish stain on the eyes, and see those little dots up there where it says DSH, that's domestic short hair, and you can see a little dot on the eye, not this light in the middle, but down by the bottom inside. See little greenish dots. Those are ulcers, just like you get on your lip from a herpes infection. They get those right on their eyes. Can you imagine? Oh. And then next to that, the DSH, 6 months old, you can see those little tracing. It looks like worms on the eyes that are kind of greenish. That's also ulcers from herpes. And then below it says Persian. That's a big ulcer that has caused the eye to take up the stain. The greenish stain only stains the eye where there's ulcers, and so that's why it stains green. But anyway, with herpes, most cats get over it again, and it is the most common type of eye infection. But those cats that don't may, and if it's severe, it can infect the eyes, and it can even affect the skin around the eyes. They may need antiviral drugs. And one drug that I've used that isn't too expensive and is really good to try is something called Viralice. It's L-lysine, and you can get it in a gel or powder and use it on cats. And some cats will improve with that alone. And if not, they may need the other medications, antivirals that I mentioned. Anyway, I hope you kind of got an idea that cats can get eye infections. Herpes is the most common, but they usually get over it. They can also get bacterial infections, and you can use ointments and medications to help them with that. And also the eyes can be irritated by dust and pollens. They can have hay fever. But if a cat ever holds its eye closed or looks really painful, it's better to get them checked out and make sure it's not a cat bite or cat fight wound to the eye or a little piece of a plant that's under the membranes and irritating the heck out of the eye. Anyway, check out Dog Dish Diet if you have a chance. It's got information on feeding dogs, and you can even home cook for your cat. Have a great day.